Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine. In today's video, we will continue with the asphyxiant. In that, we will talk about war gases. The term war gases includes any chemicals which may be gaseous, liquid or solid, which is used to produce destruction or damage mostly in times of war. So, any chemicals which is used for a purpose of war is considered as war gases. They can be vesicants, asphyxiants, lacrimators or tear gases, stimulators or nasal irritants, parasits or nerve gases. So, these are the 6 classes of chemicals which are used mainly for war. Coming to vesicants, these are mainly sulfur, mustard gases, phosgenes, oxamcide, levicides, that is arsenic. These are water liquids which continue to give off vapors for days or even weeks. Whenever they are released, they continue to release their gases which may continue for even for weeks. They are discharged in artillery shells so as to saturate the area of any area of attack. Mustard gas causes irritation of the eyes, nose, throat and respiratory passages, skin erythema, blisters, nausea, vomiting and abdominal pain. Bleeding and blistering within the respiratory system, mucous membrane damage and pulmonary edema also seen with the mustard gas. It passes through clothes into skin and produces intense itching, redness, vesicant, ulceration especially of the moist areas. So, typical mustard gas is the typical vesicants which has irritant effect which can causes vesication. It can also penetrate, passes through the cloth and absorb from the skin leading to blister formation, nausea, vomiting and the different can cause irritation of respiratory passages. Treatment of vesicants: wash the affected area thoroughly. I wash with sodium bicarbonate solution BAL, that is British anti-alveolate chelating agent. Then bleaching powder in the form of jelly or 0.5% hypochlorite solution rapidly neutralizes the mustard gas or levicide. Then N-acetylhistamine reduces inflammatory response in mustard gas exposure. Povidone iodine is useful within 20 minutes of exposure, protects the skin from vesication in mustard gas exposure. Respirators protect the face and respiratory tract if there is exposure to gases. Coming to the next group of war gases are asphyxiants or leg irritants. These are chlorines and phosgenes which are gaseous and can be released from tanks or gas cells. Chloropicrin and diphosphine are liquids which are used in gas cells. Phosgenes 10 times and chloropicrin 4 times more toxic than chlorine. Nitrous oxide, sulfur dioxide, ammonia which produce chest tightness and pulmonary edema. Arsine, cyanogen chloride and hydrogen cyanide are also used as a form of asphyxiants. Their action is mainly on the pulmonary alveoli. When inhaled, they cause watering of the eyes, coughing, dyspnea, tightness of the chest, headache, vomiting, restlessness, stretchless breathing, cyanosis and collapse. Death usually occurs in 24 to 48 hours due to acute pulmonary edema. Treatment: eye wash with boric acid, oxygen, adrenaline, antitussives and antibiotics. So, the symptomatic treatment is provided for asphyxiants group of war gases. Then lacrimators, which are known as tear gases. These are usually used as a crowd control agents and not as a fatal poisons. These are mainly includes chlorostophenone, which is solid, and ethyl diacetate and bromobenzyl cyanide, which are liquids. Other chemicals include xylobromide, 2-chloroastophenone, dibenzophenes, orthochlorobenzodiazine malonitrate and 2-chlorobenzyl malonitrate. About 15 types of tear gases are in use. CS is the most common popular due to its strong effects and lack of toxicity. The liquid usually becomes gaseous at normal temperature and pressure. Whenever they are released, liquid form is formed and normal it easily evaporates. They are used to disperse riotous mobs. They are fired in artillery shells or pavilions. Coming to symptoms, the vapors cause intense irritation of eyes with copious outflow of tears, spasm of the eyelids and temporary blindness. They also cause irritation of air passages. In long continued exposure, there may be nausea, vomiting and blistering of the skin may also start to occur. Treatment: patient should be removed from the affected area to the fresh air. Eyes are washed with warm saline or boric acid solution. Weak sodium bicarbonate solution is applied to the affected parts of the skin. IV aminophylline or salbutamol inhalation is helpful for relieving of irritation. Next group of war gases are the tetanus or nasal irritants. These are solid organic compounds of arsenic and are fired in artillery shells. So these are mainly compounds of arsenic and they are fired from artillery shells. They include diphenylchloroarsine, hyphenylamine chloroarsine, diphenylchloroarsine, which are also known as secreting gas. Symptoms causes are the vapor causes intense pain and irritation in the nose, sinuses, sneezing, headache, salivation, nausea, vomiting, tightness in the chest, and prostration. The symptoms are comparatively shorter in duration. Next are the paralysis, which causes paralysis. This includes hydrocyanic acid, sulfated hydrogen, and carbon monoxide. So carbon monoxide, hydrocyanic acid are common, which are discussed in future videos. Nerve gases. So these are the term nerve gas is a misnomer and it's incorrect to mention that these are usually the esters of phosphoric acid and are identical in activity, identical to similar to that of organophosphates, which are used mainly as insecticides. Commonly used insecticides include organophosphate compounds. The major agents includes gabin, sarin, and soman. The vapors are heavier than air, so they tend to sink into the valleys, trenches, and basements, hence commonly used in wars. The agents are oily in consistency and do not degrade or wash away easily and remain on the clothes or other surface for longer periods. And organophosphate compounds are notoriously can be absorbed from the skin surfaces, and if it is present on the cloth and because of the stickiness they slowly get absorbed in if the person has that cloth and it can be absorbed from the clothes. They are colorless, odorless, and volatile liquids. They are absorbed from the lungs, gastrointestinal canal, skin, or conjunctiva. They inhibit acetylcholine esterase, and because of that acetylcholine starts accumulating in the neurotransmitter. So since acetylcholine get accumulated, they act on the neuromuscular junction continuously. So because of that there is continuous stimulation of the nerve endings. So acetylcholine esterase actually act on the acetylcholine to break down the acetylcholine, but once the acetylcholine enzyme is inhibited by these nerve gases, the acetylcholine can act on the nerve endings to stimulate. Signs, symptoms, and treatment are similar to that of organophosphorus. So organophosphorus mainly produces muscarinic and nicotinic symptoms. They usually causes secretions like lacrimations, then salivation, urination, defecation. Those symptoms will be caused, and muscarinic symptoms and nicotinic symptoms. They are most toxic of the known chemical agents, and they can be treated similar to that of organophosphates. Exposure to large amount of vapors may cause loss of consciousness within seconds, followed by several minutes later by convergence. Absorption of large amount causes severe bronchospasm, hypotension, bradycardia, and cardiac arrest. Muscles becomes flaccid and breathing stops when the person consumes large amount of dose. Treatment: full body suit and respirator gives protection against organophosphate gases, which is again treatment is similar to organophosphorus. Atropine is the treatment of choice. Oxime is also helpful. Come to different types of warfare which is used commonly. First is chemical warfare. Here the offensive use of non-living toxic products produced by living organisms is considered as chemical warfare. So usually the chemicals are used in warfare. The agents are chemical substances used to injure or kill the enemies during war. They produce physiological changes on the human body. Some substances are lethal, some injure or incapacitate the people. So based on which chemical is used, they can either cause death or just cause some form of injury. These agents are dispersed in tiny droplets through chemical shells, spray tanks, bombs, or missiles. Harmful effects are caused when the chemical is inhaled, ingested, or when it comes in contact with the skin or mucous membrane. So anyway, when the bombs are fired, the chemicals when sprayed, they can be absorbed from the skin or can be inhaled, which is common there, or it can be ingested. Types: there are different chemicals which are asphyxiants and different group of which I mentioned like lacrimators, parasites, nerve gases. So example includes sarin, soman, tabine, which are organophosphates, blistering agents like mustards or levacides, cyanides, hydrocyanic acid. These are a group of compounds which causes paralysis. Choking agents like phosgene, incapacitating agents like tear gas or pepper spray. Then some other compounds include ammonia, chlorine, arsine, hydrogen sulfide, sulfur dioxide, phosphine, methionine, chlorhydrate, sodium nitrate, cocaine, arcanite. All these compounds can also be used as a form of in case of chemical warfare. Then some agents are also used to control as crowd control agents, which includes chlorobenzyl methylmalonate used by law enforcement agencies and military. Then CN, which is also known as available in devices used for self protections. Then oleoracin capsaicin, which is nothing but extract of peppers, consists of capsaicin, affects the skin, eyes and respiratory symptoms, causing irritation and watering. So in oleoracin capsaicin, they usually consist of angel spray, consists steam spray or foam containing the agent. They are used as defense agent to incapacitate individuals temporarily or disperse the groups. Came to next is a biological warfare. Biological warfare is defined as microorganisms or their products of metabolism that infect or grow in the target host, producing clinical diseases that kills or incapacitates the humans or animals. So here the microorganisms are commonly used or their products are commonly used. Some animal products also used to infect or grow in the target host, producing disease which may kill or incapacitate the target people. So CDC in US has categorized the biological warfare into 3 categories. Category A, these are high priority agents, can be easily transmitted and disseminated, results in high mortality, have potential major public health impact, may cause public panic or require special action for public health preparations, like common like anthrax and smallpox, which can cause panic in the community. Next is the group B. These agents are moderately or easy to disseminate and have low mortality rates like ricin, abrin, brucellosis. Category C, these agents are emerging pathogens that might be engineered for mass dissemination because of their easy availability, ease of production and dissemination, high mortality rate, or ability to cause major health impact like H1N1 or HIV. Bacillus anthracis, smallpox virus, botulinum toxin, and ricin are the commonly used agents for biological warfare. Other agents include bacteria causing plague, cholera, typhus, brucellosis, salmonella, Ebola virus, abrin toxins, tularemia or kefir. So mainly the bacteria toxins should be treated with antibiotics and related compounds. Very small amount of biological agents or toxic can also cause mass casualties. So commonly just a single dose can also cause mass casualty in the community. The agents are odorless, tasteless, and invisible to the naked eye when aerosolized, since it can be easily administered. Dissemination of biological warfare agents can occur by aerosol spray, explosives, or food or water contamination. Remote control devices are also used for dissemination of the agent. Bioterrorism is the use of biological agents for terrorizing people to settle scores with enemies. So that's one form of biological warfare by terrorizing the people. Coming to autopsy in case of death by biological warfare. So the mortician should be very careful in case of death because of biological warfare, since the person doing autopsy can also get infected with the similar agents. The body should be cleaned with 0.5% hypochlorite or phenol and transported to mortuary in impermeable double bags. Certain bioagents such as smallpox, tularemia, viral hemorrhagic fever, and as give fever can be transmitted to person performing autopsies. So collect the blood, CSF, and tissue samples or swabs should be used to isolate bacteria and viruses. These are my references. Thank you.